Okay, good evening. Pursuant to chapter 2 of the acts. Pursuant to chapter 2 of the acts of 2023, this meeting will be conducted in person as a courtesy via remote means in accordance with applicable law. Please note that while an option for remote attendance and group participation is being provided as a courtesy to the public and board members, the meeting hearing will not be suspended or terminated if tech problems interrupt the virtual broadcast unless required by law. Viewers can visit the local scene.media/Duxbury, formerly PAC TV, to watch a video replay of this meeting on Duxbury YouTube. Welcome. This evening, we're going to, did you have to?
Yes,
watch?
please.
Yes.
I don't have, we have down to one microphone again, I see.
No.
Oh, look at that. So we get one.
I call the meeting of the Duxbury Select Board to order.
Okay,
That's it.
well done, sir.
Thank you.
And I don't think there's nobody else here. Okay, great. We're going to be dealing with public safety tonight. We're going to start off with fire department, followed by police. And then we're going to come in with facilities. Out of the agenda, we're kind of going to be working down from the most impacted departments. And then not that it's not key, but municipal and then harbor master, because the cuts to the departments were not quite as much to explain. And with that, unless Mary, you've got something, do we have any minutes? We're all set?
We're all
Okay,
set.
great.
We will get started.
Why don't you start?
Good evening, everybody.
You're up.
First off, I'm gonna move around a little bit. I find it much easier to interact with everybody. I have a little presentation. My name is Rob Reardon. I'm your fire chief, if you don't know who I am. First off, I want to thank you all for coming and everybody who's at home listening on Zoom, and of course, the select board and FinCom. I think tonight is very important. It allows our departments to get out there, get ahead of the message, and present what we are facing as departments. I know there's a lot of information out there, but some of the information, honestly, from my perspective, is not correct. There's misinformation, disinformation, and tonight you're gonna get our perspective as department heads of what we are going to see, whether we get a funded budget or we were to, be faced with layoffs. So one of the things that I've heard out there numerous times is this information hasn't been transmitted. We haven't told people about the situation we're in. This slide I believe I've used for the last 4 years when I've started my FinCom presentations. To reduce the impact of an emergency, there needs to be a response of the right number of trained people with the right equipment in the right time. And tonight, one of the biggest parts of that is the people, our paramedics, our firefighters. We're gonna go into some detail tonight, show you some data of basically what we are facing at the fire department. I would just ask if you could hold questions till the end. I probably will answer a lot of them, and I don't mind answering anybody's questions. There we go. So the first slide I want to show you, I'm going to read it because I'm sure not everybody can read it in the back of the room. But this is a cutout from the 1978 town meeting. So why are we going back 46 years? Chief Howie Blanchard, he said back then, simultaneous calls are becoming a practice more than the exception. 46 years ago, we were looking at that. That's the same that we're dealing with today. We haven't solved that problem. So let's go back to 1979, the year after that was put out. The year after that was put out, we went to 5 firefighters per shift, and we were doing 1,107 calls. Last year, 2024, we did 3,000 calls with 6 firefighters on shift. That's an increase of 171%. Now, I want you to think back, if you were alive in 1979, what has changed in this town? Basically everything. Our population has doubled. There are many buildings. The building we're sitting in right now, this wasn't even here. But one thing that has changed very little is public safety. And you're going to hear it when the police are up too. our staffing has not kept up with the growth of the town. Here's the simultaneous calls. Last year, we did 1,472 simultaneous calls. A simultaneous call is 2 calls, 3 calls, 4 calls that are going on at the same time. It happens on a regular basis. It prevents us from responding adequately. I'm going to break it down in the coming slides. It happened today. Within an hour and a half, we ran 4 emergency calls. We had 3 medicals, followed up by a 4-car accident on the highway. Come the 4th call, we have nobody left. We're running out of resources on the 2nd call, never mind the 4th. So how do we respond to that 4th call? We're relying on other towns, if they're available, to come in and help us. Here's another stat. 273 times last year, we called our firefighters back from their homes. So 273, that's more than 2 out of every 3 days. We are supplementing on-duty firefighters with people from their houses. That's very difficult to keep up with. One of the things we saw on social media is that 273 firefighters. No, that's 273 instances. So you might be calling back 5 firefighters, you might be calling back every single firefighter. So that's a large number of firefighters we rely on off duty to come back. You know what, that screen might block some of it, but we'll, hang on, have a second, because I want to show you a graphic that's going to break down how we respond, and I think it will clear up a lot of confusion of why we are short on people. Here we go. Perfect, great. So right now, in the town of Duxbury, this is what you have for on-duty firefighters. We have 2 fire stations, the one across the street and the one at Ashdod. You have 6 firefighters on duty. You have 4 firefighters at Station 1 and 2 at Station 2. So we're going to review what would happen if we got a call right now for an accident on the highway. And I say that because we're up there on a regular basis. We do a lot of them. You see it on the news. I gotta get a little closer. So the first one to respond will be the captain in the car. We send 2 firefighters in an ambulance to respond. And then down below, you see 2 firefighters come out of Ashdod in the engine. Let's say this is south of exit 27, which is also exit 12 now. You're sending your whole crew quite a distance, leaving 1 firefighter back, number 6. Now, quite commonly, when we go out on the highway like today, we had a report of 4 motor vehicles with multiple patients. So what do we need to do? We need to send our 2nd ambulance. So as you can see, at this point, we have nobody left in this town. We've used every firefighter paramedic that we have to respond to that first call. This is where we get into trouble with simultaneous calls. Our job is regulated by Department of Public Health, OEMS, and every one of our firefighters have a license. So one of those things that we must do is if we have a trauma patient, we need to put another firefighter paramedic in the back of the ambulance. So if we have a trauma patient, we have to move somebody from another truck. So you see number 5 now gets in the back of the ambulance. This is a decision made by the paramedic. It's made for the benefit of the patient. We don't just put somebody back there for the fun of it. We're usually starting IVs, medications, breathing tubes. This is the emergency room being brought to you. So similar to today, if you have multiple patients, we now have an ambulance being driven by 1. Can't do that. We have nobody in the back. So we take number 4 and they get moved up there. So right now, if you call 911, who's left in this town? There's nobody left. Unfortunately, we do this on a regular basis. We are constrained by our people power. We only have so many people. So if you look at this, 2, 3, 4, 5, 2, 3, 5, 6, and 4, they're all going to the hospital. I'll show you on the next slide. We are facing a hospital crisis where our response times to the hospital and then add in the length of time before we get a bed. We're waiting up to 2 hours at the hospital. So your firefighter paramedics, these calls are taking upwards of 3 hours. So take all of those firefighter paramedics, they leave the town for 3 hours. Seems crazy, but unfortunately, that's what we're living with. So let's go over the impacts of patient transports. For every transport, at least 2 firefighter paramedics or EMTs are leaving this town. So it's different than a lot of other departments where your job doesn't take you out of town, but our workforce leaves this town all the time transporting patients. How many times? Well, let's first look at averages. We're averaging right now at the hospital, we just did it, 90 to 240 minutes. That's the amount of time we're spending trying to get a patient to bed so that we can get back into service. So we made the decision years ago, prior to me becoming a chief, that we needed 3 ambulances because we were getting busier, which we are. But one thing we didn't do is we didn't staff it. We didn't hire anybody additional to staff it. So in order to get that 3rd ambulance on the road, we typically are requiring people to come back off duty so we can staff it. Last year, we did 1,171 transports. And the important number to look at here is age demographics. Our town is getting older. So the over 60 population is increasing. In 2025, we have over 5,000 residents that are over 60. Talking with Joanne at the senior center, that number is only going to increase. Estimated 7,800 in the coming years. But look at this stat right here. Last year, we transported 1,253 patients who were over the age of 60. So you can see the demographics of who is calling for us, who needs our help. So measurables, how are we measuring the service that we provide to people? So there's 3 key indicators that we use. First is response times, which I'm going to show you a slide on. Second one is the number of incidents. We're gonna go into that. Fire loss, we're going to talk about that. But fire department satisfaction. All I can tell you, and we have to be careful because of HIPAA, is the amount of people's lives that we have saved. And I'm not talking about going to a nosebleed. I'm talking about people that were not breathing, their heart wasn't beating in the last several months is incredible. And if we didn't have the right staff or the people to get there, that would have been much different. So here's a snapshot of the last 10 years. If you look at our total calls, and I handed this out to some people, it's available on the website, you can see a general increase. Now, yes, there are some years, some anomalies in there, but if you look at 2021, 2022, we had a lot of storms those years, windstorms, and our activity increases. So we'll go from, doing 10 calls on average a day. So we might do 50 that day. We might do 75, and on bad storms, we'll do 100, which is incredible when you think about 6 people and then bringing people off duty to handle that call volume. The other breakdown on this is EMS and fire. We're pretty even as far as our EMS and fire calls. We do a lot of medicals, but also we do a lot of fire calls in this town. So we have standards in the fire service, NFPA, National Fire Protection Agency. One of the standards that's very important, we've always tried to stay close to it, is the time of call to arrival must be within 6 minutes, 90% of the time. Now, this is a graphic we've shown for years. If you look back in 2014, we were hitting that 80% of the time. So we were 10% below what NFPA would like to see. But if you start to follow it, it starts to go down. But in 2022, we went back up. Now, there's a couple reasons. During COVID, our call volume decreased a little. 2022 and 2023 is when we started staffing 6 firefighters 24/7. We had never done that. So you have more firefighters, you can get to calls quicker. So we brought that number up. But if you look at 2024, you'll see those numbers have decreased again. And why is that? Because we can't keep up with the call volume. The call volume keeps increasing. The calls come in at the same time. It makes it difficult to respond. Here's your simultaneous call. This is our biggest issue. If you go from 2010 to 2024, you can see gradually up and up. And again, you see the multiple storms. But it's not just 2 calls, it's 3 calls. So I'll read this for anyone who can't see. In 2024, 1,472 simultaneous calls, 563 or more calls at the same time, 174 or more, 61.5 or more. Those become very difficult to near impossible to respond to in an appropriate fashion for our departments. Here's the off-duty recalls. Clearly, we only started tracking this in 2020. That's why we only have the last few years of data. We decided in 2020, this is an important stat that we need. So we track it on every time we recall firefighters. So you can see in 2020, we were under 150. Last year, 273 times. It's unsustainable. That's why we are trying to increase staffing, never mind lose staff. So this is my stick figure demonstration of our department to break it down, because it can be difficult to understand how we staff. But we have 4 groups that work. So if you look at Station 1, we normally have 6. My request in FY26 is to add that 1 additional firefighter per shift. So that would bring us to 7. If the override doesn't pass, we'll lose those 4 that I'm trying to get and 2 additional. When you lose those 2 additional, we go back to staffing like it was in 1979 on 2 shifts. A little bit about what the ambulance brings in for this town. Last year, we brought in over $1,300,000 in ambulance revenue. That's an increase of $158,000 from the previous year. A number of things we did, you've heard a lot about the Sustainable Task Force. We worked with them. I worked with Mary, finance director, and we worked at ways to lower the fees we're paying for ambulance billing, to increase ambulance revenue, and we put some measures in place at the fire department to capture that revenue quicker. 80% of the money goes towards the general fund, so that pays a lot of the bills for us. 20% goes towards our capital, so that will go towards paying ambulances. One important thing to consider is if we were to lay off firefighters, paramedics, they do both jobs, you will see a decrease in them, because we're going to rely more on mutual aid in other towns, and when they come in, they will capture that revenue. Additionally, we brought in $26,000 in permit inspection revenue, and then Medicare, some additional revenue that we got back. So if you take a look at the revenue that the fire department generates, you'll see that pays close to 1/3 of our budget. In addition, anyone who's ever tuned into the FinCom meetings, you'll see we've pushed this for years. We're heavy into grants. Before we come to you for money, we do our best to find alternative sources of funding. So just in the last year, quickly looking at it, we had a gym funded, we had a 6x6 funded, structural boots for the firefighters, grants, shelter supplies, conference room furniture, sheriff's department painting, mobile data terminals. And the list goes on and on. So we do our best to find alternative funding. But unfortunately, this is another area we just found out today that we're going to suffer the consequences of the MBTA Act. So a decision was made by the town several months ago at town meeting to not do the MBTA Act. We were told today that we are not going to be eligible. They've actually pulled our grant funding. So as of today, I won't get any funding for firefighting gear, which I had planned on. I'm also going to lose funding to go to schools. Every year that I've been here for almost 25 years, we go to the schools, we teach the kids, and that's a funding source that we are now at jeopardy of losing. Those are things that I worry about. If we are to lose our funding, never mind the override, but we're also losing this, this is going to put us in a critical state. It's going to be very difficult to provide the services that we provide today after June 30th. This was a text I got from a gentleman that we saved his life about 2 months ago. So Paul sent me this text. This moment with my granddaughter on the beach in Aruba wouldn't have happened without the fast response of DFD. So if you hadn't heard the story of Paul, Paul collapsed in the woods. He had no heartbeat, he wasn't breathing, he was clinically dead. Luckily, he was the first person to call. Well, he didn't call, but a good bystander called. So we had everybody. And the police had everybody, because we needed everybody. This wasn't a one-team operation. Just like us, we need them. We respond all the time. So police officer got there first, started CPR. We got in there. And as a team, we were able to get him out of the woods. And he's in a beautiful place with his granddaughter. So I recognize the importance of fiscal responsibility. However, we must balance that with ensuring the right number of responders are there when someone is experiencing their worst day. So our department responded to 3,000 calls last year. You know how many calls they expect perfection on? Every single one. When people show up, they don't want to hear the excuse that, I'm sorry, they're tied up on another medical. Kingston will be here soon. I would ask if anybody has any questions. I'd be more than willing to answer anything you might
Why
have.
don't we're gonna work with the selectmen
Oh,
first,
selectmen.
and then at the end of the meeting, we're going to be opening up the public discussion. Now, we have a big agenda to get through, so if the selectmen have any questions this evening.
Yes, yes.
First, you run a phenomenal department, and thank you to your staff and everybody for all that you do, because all that I hear is perfection, so you do a great job.
Thank you. That usually comes from customers too. I'm not saying you're a customer, but customers usually love.
We are in this state. What kind of cost saving measures over the last year or so have you gone to the table and tried to scratch from your budget, knowing that this was coming and that the budget letters were coming up and things of that nature?
So if anyone didn't hear that question, it was, what cost saving measures have we done? I think we have done the best we can to try to cut any fluff that we have. And I gotta admit, we don't have fluff. And I feel like for the last number of years, we have done everything not to add to the budget. The only place that we're adding is people. But what we're facing at the fire department, probably like every other department here, is expenses have gone through the roof, just like at your home. So I'm seeing service contracts going through the roof. So we can cut, but the cutting's not gonna work because my expenses have gone through the roof. Everything's electronic. I'm sure you've seen it at your house. My stretchers are electronic, my cardiac monitors. So I'm in huge service agreements. If I don't get into these service agreements, I just had an EKG machine go down the other day. It would have cost me $34,000 to fix that. He said, but luckily you have the service agreement. Well, that service agreement just increased almost 25% over the last 2 years. So now I'm paying $16,000. Now figure that out over everything. So things that I've tried to do, every year we've come up short because I need more people. We're responding to more emergencies. So in June, when the septic system needs to be pumped, I gotta make a decision, the deputy and I, you know what? We gotta hold off on this. We don't have any money. Those are the things that we're doing. So we don't have enough money to cover our basics.
Just to that end, a lot of the difficulties you have go with the paramedic end. Has the town thought about, or has your department thought about contracting with, like, say, a coastal transportation or somebody like that that can take the transportation and on a medical, so you don't lose someone for 2 to 3 hours?
Sure. So unfortunately, that's something that's been brought up many times by the FinCom. We have done extensive research and studies on this, and there's a number of things I want you to think about. I showed you the $1.3 million. We contract with an ambulance company, that's gone. So there's number one. Secondly, there's no such thing as a zero bid ambulance. So if you want to bring an ambulance in here, you're gonna look at $1 million to pay them. So we're at 2.3 million. What do we still have to do? We still have to respond to fires, motor vehicle accidents. And if you look at any of these towns that use private ambulances, guess who responds at every call? The firefighters. Guess who's helping carry people downstairs? The firefighters. So no matter what, if you want to use a private ambulance, I think it's a horrible idea. And I think we have to stay strong with what we have. We have highly trained paramedics here that I'll put against any town. And if you look at the service that we're providing, it will be nowhere, the private ambulance will be nowhere near what we provide or the level. If you look at what private ambulances are providing for other towns, they're not providing 3 ambulances unless you're paying quite a bit of money. You can look at Plymouth. The other thing is these private ambulances are, to be very honest, will not come in here and try to take it away from us. Because we've talked to them about how much they charge, and they've made it very clear, we're not looking to come in and take your ambulance service away from you.
No, well, I was gonna say, does anybody else?
Yeah.
Just a quick question. You said you had 273 recalls, in 2024. How many people is that? Are you keeping track of that number?
Yes, we have every time, so we're data driven. So you can ask me anything and I'm gonna give it to you. So I can tell you today, I think today we had 4 come back, but what do you have?
At 1,833 out of that 270.
1,833. So 1,833 of our staff, if you take 273, some calls it might take 4, some calls it might take 15 of us. It depends. This is a team sport. I can't do it with one person. You're on the 2nd floor, you're having a cardiac emergency. I can't do it with 3 people. We have cardiac monitors, we have medical equipment, and we have brute force. When we come in, we have a mission to do, we do it quick, we do it effectively. If you don't have people to do that, the person suffers.
Thanks for all you do.
Thank you.
Thank you, Rob, and yeah, thank your whole department for all you guys do. I have a question about the overtime costs. So the recalls, calling back in all the off-duty firefighters must be a very costly venture. So could you give me an idea of, I have to believe that a new hire may be more cost effective in the long run than the constant use of overtime. Can you speak to that?
Sure. Having people on staff in the building is great. And I think the question has come up many times, if we add one person, will we reduce overtime? Will we get rid of overtime? But unfortunately, I can't dictate what the call is gonna mean tonight. You could give me 3 more people on shift tonight and put me at 9 people, but you know what? When we have a house fire and we have a medical and we have more calls, this getting rid of calling people back is probably never gonna happen. But what we can do is we can lessen it, so it's not every day. So when we're handling the multiple medicals, I'm not sure if that answered you exactly. Did that help you?
It helped. I'm hoping to get, is it going to save us money in overtime by having another full-time? Do you have any idea how much that savings?
Yes, we definitely will save some money by hiring, but it's not all going to disappear. That's just me being honest. I can come up here and tell you that it's gonna eliminate it, but it's not going to completely eliminate that. We work in a job where when somebody's not there, I don't have the luxury of not filling that position. This isn't a desk job. This isn't somebody that is in a position where they're greeting customers. These are people driving fire trucks and ambulances, and I need them there. So if the passenger in the ambulance, who's my medic, takes the day off, if they're not there, we can't just say, we're not gonna fill it. And that's where we are different, and it's no different than the police. We have to fill those positions, and there's overtime. So contractually, people have vacation time. People have babies, we have sick time, and those have to be filled. I do see a decrease in the emergency recalls, but I'm not gonna stand up and say that it'll be eliminated, there'll be huge savings. I think getting to 7 people is it's crucial. And a couple years ago, somebody in the town had suggested, let's do a study. I would welcome a study, but I think you'd be shocked, and I think you'd be told, you don't need 7, you don't need 8, you probably need 9. That's just my honest opinion. If you look at studies that have been done, if you compare us to other towns, and you understand it, I work in the fire chief circuit. So we all talk. We know what each other's staffing is. We know what they're running for calls. And I'll just say, we are all subject matter experts. I'm not gonna tell the police how to run and what he needs for staffing. I'm gonna give you as a fire chief what I think we need. And the decisions have to be made, what can be funded. And in the end, if we don't get that funding, we are going to do our best to respond with what we've been allocated.
Hey, Chief, thanks for that. I've only been on the board 2 years, but from the first time we talked, we've been talking about staffing and issues, having to do with being able to respond in a way, with the equipment that the townsfolk require and deserve. So I'm glad we're finally having this conversation about being able to make the changes that we've been talking about. I know they go way before me as well. And I appreciate your patience in beating the drum, but sticking with it, to make this happen. One thing I just wanted to add, just coincidentally, today, the Mass Municipal Association had a program, on municipal aid, mutual aid, excuse me, and, talked about fire service. And I just want to illustrate for everyone that this is not a Duxbury specific issue. Communities across the Commonwealth are all dealing with staffing, in particular. And, one thing that struck me, and I spoke with the chief about this before, when we talk about mutual aid, and in his presentation, one of the things he said is when those stick figures go to other calls, we're backfilled by other communities, but those other communities have responsibilities to their own residents. And with the other towns being stretched as well, I think it's just a matter of time before mutual aid, this is just me projecting a little bit, is a little less mutual, because everybody's got to protect themselves. And I appreciate this department's foresight in staffing up for the real needs that we have, and I appreciate that.
Thank you. And it brings up a very good point. I think it was last week we responded, we had 3 medicals going on at the same time. So we call our neighbors for help. The first town was unavailable, we call the second town, it's Kingston. Kingston's in the same boat as us. They're on their 3rd medical. We're all facing the same thing. If you look at other towns, they're increasing their staffing. This is something that we've been talking about for years, and I think it's very important.
So, yeah, Amy asked the question I was gonna ask with regards to overtime. So, yes, you will have an increase in staffing. You should see something, but obviously it can't go away depending on situations. But we will see some measure of reduction in overtime. Is that correct?
Absolutely, you will see some, and that's reflected in the budget. I removed some overtime out of that, so yes, correct. Good one.
Yeah. Oh, go ahead. Go ahead.
I could be like Phil Donahue.
He's dead, I think.
Oh, sorry, sorry, Phil.
Awkward.
Chief, would you mind addressing a question that gets asked of us quite frequently, which is with respect to responding to issues out at Sequish? So I have a lot of folks who contact me and ask whether the town has the capability of charging the town of Plymouth every time that you respond.
Sure.
And can you sort of talk about the limited call volume that we have out there and what happens when we have to send staff out to that area? Thank you.
So we rely very, very heavily on our neighboring fire departments. Very, very good relationships. And one of our biggest partners is Plymouth. They bring a lot to the table because of the size of the department. So Chief Foley and I have a very good agreement. Anytime we respond to Sequish, he sends an engine up here. His engine is staffed with more firefighters than we ever staff an engine with because we don't have them. So we're up as soon as he gets here. So if we get a call out in Sequish, immediately we notify Plymouth. Plymouth sends an engine here. They cover our station. We respond to Sequish. We go out to Sequish very infrequently. We've gone out there for, campfires, nothing major. We've had a couple building fires over the years. But they tend to be medicals. And when we respond to a medical, what happens? We charge and we take money in. So we are making money. And Plymouth, like I said, is an extremely, extremely good mutual aid partner who have been here for us when we needed help. And anytime we are busy, he's the first one to call me and say, I'll give you anything you need to help you out. Was that okay?
Yes.
Thank you.
Appreciate it. So one of the things that I'd like if you touched upon, because I think it's going to impact you, and I know it impacts the police and other public safety, is the the staffing that you have now, the younger guys and their, desire for overtime and how having this constant need of bringing them back in impacts your morale and impacts how you conduct business.
Sure.
And this in no way, shape or form is a judgment on that change in attitude, but
Absolutely.
it's just a fact of,
Sure.
of this.
Did everybody hear that question? Can you hear that microphone? Okay. So we're recalling these firefighters on a regular basis. That can be a draw at times. Firefighters do like to make overtime, but you also have to understand society's changed. It's changed from when I got on the job. And one of those changes is we have amazing firefighters with very successful counterparts. They're dual income families. No more is the day where the firefighter can work and their counterpart is at home. So a lot of times when our firefighters come home, they're relieving mom or dad who is then going off, who's a nurse, who has a very successful job. So not always is the fact that they might not want to come back, it's they're not able. They have kids. We have very young firefighters. And one of the other things that I want to make very clear is we're looking at laying off 2 of our firefighters, 2 of our youngest firefighters, 2 firefighters that we paid to go to the fire academy, that have paramedic training, that have military service, that other departments are frothing at the mouth to hire. And I'll be honest, not only those 2, I have people beyond that who are already looking at jobs the other day. I had a firefighter come into my office the other day to tell me that I am applying at blank department. So if that chief calls, you know. And he said, there's nothing more I want than to work for you in this town, but I need a job. And that's what's happening. And if you do a little bit of research and you look at Hanover, I'm very close to the Hanover Fire Chief. They are in a bad way right now. They voted down their override last year. They had 3 firefighters leave or who were laid off. This year, they're looking at more layoffs. They have, their fire department has a major morale problem because who wants to stay in a department that is unfunded or underfunded? And that's just the fire department. And I'm afraid if we don't get supported, we are going to be in the same situation because I'm seeing it already.
All right, thank you, sir.
Thank you.
I'm sorry.
I think we had some folks in the audience.
I was gonna do the public at the end, that way we can get through the agenda and, you know, unless somebody has to leave or whatever, certainly I don't want to deny anybody the ability to ask a question, but I just as soon have public comment at the end of these presentations, so we can get through the agenda.
Betsy, can I just, is everybody okay with that?
No.
I didn't time to do it after.
Oh, okay.
It's right on top of our head right now.
Oh, Jesus.
Just to, to Schofield, James Road, up it's on or not.
Oh.
My only comment on that. Thanks, Bill. Is that last Thursday when we were here, I think there was 5 minutes left at the end of the meeting for public commentary. So if you're trying to get the public involved. and
We're
to
planning on
understand-
going later tonight. We've
Okay,
made that accommodation.
Thanks for not letting me speak.
No, I'm sorry.
You asked us a question if we were okay with it, and we said no.
No.
Okay, that's fine. Go, Sue, I didn't mean to
Then you
cut you
just
off.
shut her down. Then you just shut her down.
I'm sorry. I didn't mean to. I was,
You did.
I apologize, and it's a terrible habit I have, and it's part of my personality, and I apologize for it.
That's the film that's room tonight.
I appreciate that.
Guys, putting the meeting out on social media. Why am I doing it?
Sue, did you have another question? I do
I
apologize.
understand. I'm too upset right now.
Okay, all right. What, this gentleman, could you give us a name so we have it?
My name is Mike Kennedy, I'm
Thank
retired
you.
New York City fireman, I know what they're going through.
Yep.
We are building, I got a big.
Can you speak into the mic?
Are you giving me a hard time too? The mic doesn't work.
Yeah.
All right. How many houses are we putting into this community now? There's 44 units coming down my street. Lincoln Street has so many more houses coming. They're understaffed. What's the problem? You know, Is it money? That's the big problem? Well, you know what? I called them 3, 4 times and they've come right away and taken me away. It helps me out. You can't put a price on it. You need the cops and you need the firemen. Cut somewhere else.
Amanda McLeod. I would just like, times like this, sometimes we need to think out of the box, and no offense to any first responders, you guys do a good job. But when I was a kid, I grew up in Norwell, we had a volunteer fire department, and the guys loved it. And anytime, not for obviously medical things, but, they could respond to fires. Obviously, they need a truck, so I know there's like $1 million, but just something to think about, if you retire a truck, it doesn't take many resources. You need a way for them to be notified, obviously, when they're needed. But just something to think about. I mean, everything just is so expensive. We have consultants and experts, and everything just costs so much. Like, go back in time. How did we used to do it? We got it done too, just things to think about.
I'm just gonna respond to that real quick. So, like I told you, things have changed, right? And one of them is attracting call firefighters. We have that problem. We have call firefighters. When I got on almost 20 years ago, we had 10, and honestly, the call force was booming. Times have changed. The amount of training we put in, the amount we put into gear, and the same thing I talked to you about our full-timers, do part-time firefighters want to come back for a few dollars? We don't see that. So what we've seen over the last 10 years is our call force go to zero, where we can't attract people. And it's not just us, many other departments see that. Now, community demographics definitely change things. If you're in a community that might be more blue collar, you take a community that might be invested in their cranberry culture, we have a lot of people around town, that might be different. We don't see that. We see people, the workforce leaving. So even our call firefighters that we have, and we have 2 of them, and we've worked hard to add to that, it's very difficult. And the amount that they come back isn't enough. And do you want to take that chance when you need an ambulance with paramedics on it to see if somebody can come from their home? So we have put a lot into that, and it's just not feasible.
Excuse me, Rob, can I ask you a question? When you have, when you call in.
Would you mind coming up? Because we're trying to record it so they can't hear. Yeah.
When you call people back on call, how long do they have to get back into service? Like say, I would say you work a 24-hour shift, right?
Yes.
So I work 24-hour shifts. I'm doing 13, 14 runs in that shift. I go home, go into bed, bang, you call me and I gotta come back. What if I'm not available? Well, they don't have the next guy. You don't have to go in, but then you're down, then we suffer.
Yeah.
That's what I wanted to ask you.
So the question was, if you couldn't hear it, how long do they have? If they work a 24-hour shift, they're running calls all night, they get off at 8 in the morning, and then at 8:30 in the morning, bing, bang, boom, we got a bunch of calls. How long do we try? But it doesn't mean they have to come in. They might be sleeping. They might be exhausted. They might have had one of the worst shifts. This isn't the Duxbury of 20 years ago. If you understand what our firefighter and paramedics are doing for calls, they're horrible. The stuff that our officers and our firefighters are seeing are unbelievable. So if they want that day off and they don't want to come back, I don't blame them sometimes. They're being stretched very thin.
Just bring the mic up close, please. Face us.
So what I wanted to say, I'm sorry, is that I understand firsthand how important the services are that are provided by our fire department, our police, and everybody else here in town. We had a tragic fire at our apartment complex a few years ago. And Duxbury responded, I think, Kingston responded, I think there was mutual aid, there was different things happening. And, I'm looking at LA right now, right, seeing what's happening. And you see the staffing issues, you see the management, and,
I don't know what, again, what the answer is. I'm not, you know, the line items and all that. I really feel like these are the most important services that the town can provide. And I think we have to take it seriously. And I don't know where the other cuts are gonna go. But something needs to be done, thinking outside the box, whether there's more grants. I think it's vicious what the governor is doing to us, penalizing communities for not supporting MBTA Communities Act. It's extremely vindictive. And I think we should consider what we can do for that. But thank you all for being here.
All set?
Please.
Thank you, very Rob. Next will be Chief Carbone for the police department.
Well, you're gonna hear a lot from me, but you already heard from Chief Reardon. That's okay. David, can you pass them down? I'll make 10. Just so everybody knows, this
Mike,
presentation.
hold on one second.
Get this loaded.
Oh. I can talk, you know. Just so you know, this presentation is gonna be on the town website. And again, if anybody here or a friend of yours has some questions about the police department and, you know, what we're going through or you want some statistics, please reach out to me. I'm probably not gonna have everything you want tonight. I'm just gonna kind of go through the basics. And let's just start with it. So, yeah, I need a clicker. So let's just start off and go through what we do, our primary functions of what we do for the police department. Well, we respond to emergencies, obviously, to reported crimes. That's being reactive. Response to medical emergencies, criminal investigations, routine patrol, traffic enforcement, crash investigations, you know, all that stuff, maintain public order and school security. Pretty basic stuff. Well, policing today has actually expanded. And a lot of what we do today is not only expanded, but it's time consuming. More expanded functions is traffic safety, education, awareness, student safety, wellness. That's the SRO program. Technology, crime investigation and education, crime scene processing, crash investigation, mental health, crisis intervention, substance use, addiction support, community policing, senior outreach, rape aggression defense tactics, junior police academy, drug abuse resistance, internet safety, and community meetings. Just some of the more expanded functions of the police department. So right now, this is the current police force we have. We have 35 full-time sworn personnel. We have a couple vacancies, but that's 35. That includes from the chief all the way down to the most junior police officer. If this is level funded, I'm gonna lose 2 current patrol positions. That's gonna put me down to 33. Right now, we only have 17 patrol officers, and this, I'll get into it further, but that's where it counts, is patrol, patrol, patrol. That's where it matters. And for the longest time, and I get kind of a little irritated about this because I've been with the department for 35 years. For the longest time, nobody ever concentrated on patrol. It was always, you know, make another detective. Let's put another SRO in the schools. All good services, don't get me wrong. But you neglected patrol. You never backfilled those officers. So what you ended up with is a lack of officers on patrol. And now we're in a position where we're realizing that, or I should say, we're trying to address that, and we're so understaffed because of it. So we are requesting that we are funded all our positions with additional 2 patrol officers, new positions. That would bring us up to 37. And with that comes a lot of benefits, and I can explain that further on. So
the division of responsibility, well, we're divided basically into three divisions, the police department. There's administrative, that's me, and the deputy and special standard sergeant. And one civilian, executive assistant. Then there's operations, there's a lieutenant, who's the commander. There's 5 sergeants that are spread across different shifts. And there's full-time officers, that should be 17, that's wrong. That would be if, we got the funding. And there are special police officers, but you can't count them because of the new police reform, we can't use special police officers anymore. So the special police officers that you see there are 4 of them. Those are retired police officers that have full academy training. That's the only reason why we can hold them as special police officers. They're strictly for details. That all has changed. In the past, we used to have 25 specials, and we were able to use them to supplement our full-time force. We can no longer do that because of police reform. I don't know if you heard a lot about post and police reform. Well, they changed all that. That's another presentation. That's a long presentation. And I'd be more than happy to sit down with anybody and talk about it. And then there's the investigations department, this division, with a lieutenant, detective sergeant, 2 detectives, the school resource officer, and a prosecution and admin assistant, which is a civilian. Again, these are different positions like detectives. We added another detective we pulled from patrol. This is over the years. And what it has caused is a severe shortage in patrol staff. Now, this is a quick snapshot of FY24 calls for service. In FY24, we had over 26,000 calls. 26,000 calls. Yeah, some of them weren't serious, some of them were more serious. The calls today are so different from what they used to be 5 years ago. They're more involved, they take the officer's time. There's more report writing, there's more forms, it's so more involved. And where in the past, and I'll get into it, I'll give you a quick little example. But in the past, officers, you could send one officer to a call and he or she could handle that. Today, most calls require 2 officers. And in some cases, it's mandatory. My guess, in FY25, we're gonna be very close to 30,000 calls. Easy, 30,000 calls. That's a lot. That's a lot. So what does our department need? Well, I've been saying it, patrol officers, patrol officers, patrol officers. The time has come, okay? And let me tell you something. In 1976, we had the same amount of patrol officers as we do today. That is disgusting, as far as I'm concerned. Unheard of. I've talked to other chiefs, and they've all told me they've never heard of such a thing. Now, yeah, a lot of departments, most departments are in a staffing crisis. There's no question about it. But we have had the same patrol staff as in 1976. And to show you that we did, well, in 1976, Duxbury Police Chief Henry McNeil approached the select board with this letter, and you probably can't read it, but it basically was a letter of him asking the select board if he could go to 3 patrols like we have today, 3 patrol sectors like we have today. He was asking the patrol because at 1976, Chief McNeil was telling the select board, calls are out of control, we've got more calls, we need to add another patrol sector to town. Select board said, sure. So he, in 1976, decided to go with 3 patrol sectors in town. And that's what we have today, the same thing. That's crazy. So, kind of comparison here, 1976 to 2024. Well, as we know, the population in this town is more than doubled from 1976 to now. Officers, as you can see, in 1976, there was 31 officers. Today, we're approved for 35, excuse me. And the only reason why you see a difference in there is because we've added, like detectives and stuff. But we're talking about patrol staff. It gets a little confusing, but we're talking about patrol staff. The patrol staff is the same as 1976. Police activities, insane when you look at the numbers. I mean, you're talking about maybe 13,000 calls in 1976, and now we're close to 30,000 in 2024. So again, I'm not gonna read this off, but I did a quick little, comparison between the policing in 1976 and 2024. And it is crazy. When you take the difference in technology, the community policing, transparency, accountability, training, the training in 1976 compared to 2024 with policing is so dramatically different. So what I'm trying to say is we're still, I'm gonna say it again, I'm gonna repeat myself 20 times. It's crazy when you think we are at 1976 patrol staff in 2024. When not only has the crime become more advanced, more involved, and more cumbersome, but call volumes up. I mean, it just, everything is so dramatically changed from the time span. It's incredible. So this is a good example, a domestic assault response. Well, in 1976, probably one officer would respond. He'd separate the parties, and most times, the aggressive, he'd say, hey, go to a friend's house and sleep it off. Right? And, a log entry would be made. That's it. Probably take maybe 45 minutes. Well, today, in 2024, 2025, doesn't matter. Multi-officer response. You got to question all the parties. In fact, that's a required 2-officer response. And in domestics, it's 2-officer response along with a supervisor. A supervisor has to go to certain calls regardless. So it's a 2-officer response with a supervisor. You question all parties, you arrest the aggressor, you transport and book the prisoner. In a domestics, it's a 6-hour hold. That means we own the person for 6 hours. They're in our cell for 6 hours. You can't bring them to the house of correction. Can't do any of that. We own them. And if that person has to go to the hospital, that person has to go wherever. We get a babysitter. And a lot of times that happens. And that's an officer tied up. We've had prisoners have to go to the hospital in Boston for the whole weekend. And that's a Duxbury police officer with that prisoner over the weekend. Because Boston PD is not gonna babysit our prisoners. They got enough of their own, or even Weymouth, when you're taking a Weymouth or Plymouth. It's not gonna happen. You're gonna document all physical evidence. Big thing now. If there's evidence, there's a whole procedure for that, so that's involved. Conference call with the victim judge to obtain restraining orders. As you know, with emergency restraining orders, 24/7, doesn't matter. You can get a restraining order. So that means if it's 2 o'clock in the morning, the officer is calling the judge, getting the victim's statement, having a 3-way call with the victim, the judge, and the officer to determine whether or not we can get a restraining order. These are all things. Now, just picture this now. This is taking a lot of time. And if you only have 2 officers on the road, you're not gonna have an officer to patrol or answer some of the other calls. Refer victim to DA's advocate, department DV liaison follow-up, arraignment and prosecution. All said and done, a domestic assault response take 8 to 24 hours of a police officer's time. It's crazy. That's a good example. Motor vehicle crashes. That's a 2-officer response, sometimes a 3. Sometimes it's mandatory that the supervisor go if there's injuries. That's a whole investigation. That could tie up the cars for hours. So this is what Betsy was saying earlier about workforce change. It's true, and I don't fault them at all. A lot of the younger generation, they just like to balance their lives on 40 hours. Nothing wrong with that. I wish I did that. And you know, what happens is they balance their lives on 40 hours. That doesn't make them available to work all the vacant shifts that we have. So that's a challenge. Nothing wrong with it, but that's the generation that we have. So, patrol staff in comparison. So, in 1976, we had 3 patrol officers, 1 station officer, and a sergeant. Today, we have 3 patrol officers, 1 station officer, and a sergeant. Same as 1976. Essential patrol staffing, my needs. I need 4 patrol officers, 1 station officer, and a sergeant, because with that, I can create a 4th sector. I can move us forward from going from 3 sectors to 4 sectors. And there's a lot of benefits to that, a lot. So you ask yourself, what is the benefits? Well, I'll run down them real quick. First and foremost, and most importantly, increase officer safety. If I go down to just, when we run light, like if we have 3, most shifts right now, there are vacancies on some shifts. But if I have 3 patrol officers and 1 guy's out, and I can't fill that with overtime, and I have 2 cars on the road, that officer safety issue is a massive problem. Massive problem, and I can't have that. Improves officer wellness and morale. Let me tell you, you want backup. You don't want to be forced in. These officers that are working an 8-hour shift, and all of a sudden they get forced past midnight and they got to stay till 8 a.m. That's a morale problem. That's daunting on some of these officers, and it creates mental health issues as well. And I will tell you, one good thing, and it's a good thing for the officers, it's a good thing for all of us. Officers, by policy, cannot work more than 16 hours straight. After 16 hours, they gotta go home for 8 hours before they can come back. Addresses the demands created by higher volume calls. Obviously, more police officers, we can handle the calls a little bit better, or quicker, and faster, and more efficient. Improves response times. Let me tell you, I tell a lot of people this, the square mileage in this town, this is a big town. If you gotta get from Keene Street all the way to Gurnett Road, it takes a while. And I don't care if you got lights and siren, it takes a while. So, and trust me, that's a big issue. You gotta get there. Focus on specific community issues. That's a lot of specific community issues you can focus on, like traffic enforcement. Well, that's the next one. And that's basically reinstate a designated officer for traffic enforcement. With 4 sectors, you could actually tell an officer, your sergeant could, the supervisor, you know, Officer Jones, you're on traffic today. You're gonna go all around town doing traffic enforcement. That's good. That's a big issue, is traffic enforcement in this town. Better resource allocation, higher community engagement, ability to apply flexible patrol strategies. That means move people around, you know, when the beach is busy, I can get a guy down there all the time. That's been a big issue. When it's beach time, I actually try to assign a guy down the beach to patrol the beach. Unfortunately, it's an overtime a lot of times because I don't have the staffing to do it. More support for programs and specialized units, improves supervision and oversight, reduces overtime to mandatory shift ordering. That's a big one. And that comes up all the time. Well, is it gonna save you money if you have a 4th sector? The question is, yes. We run on overtime just like the fire department does. There will be overtime. There will be officers who get injured. There'll be officers who have military. There'll be officers that are on vacation. There'll be officers that are out for whatever reason. And a lot of times with patrol, you have to backfill. The days of running light are over, especially in the staffing level we're at right now. If I have 3 patrol on and 1 guy's out, we try to fill it. I can't have 2 patrol cars on the road anymore. It's just not acceptable. So the days of running light are over. This is a quick snapshot of the budget request overview. So you ask yourself, well, quite simply, well, with this level funding and the 2.5 doesn't go through, it's gonna be devastating. We're gonna lose 2 full-time police officers. My overtime is gonna go through the roof. And I can't just say, well, I'm not gonna fill shifts. We'll just run light. No, I can't. That the liability of that, the officer safety, the safety of the community puts everybody's lives in danger. Can't do it. And that's just a big thing, officer safety. So, and I'll go through this quickly. People say, well, in Duxbury, how do you measure your service? Like, we hear it all the time, you're busy, you got calls, this, that, and the other thing. Well, in Duxbury, we look at a lot of things to measure our services, and this is what determines, believe it or not, other than stats, what we need for police services and what we need for staffing as well. And measuring police services, I'll just give you the bullet points, because I can hit on every one of these, but we'd be here all night. Crime statistics and trends. We look at our crime statistics and trends and we determine what's up, what's down, what needs to be addressed. Response times. We're always looking at response times because that's huge. And like I said before, this town is a big town. It takes quite some time to get across town. Community satisfaction. A few years ago, we did a community survey. Well, actually, 10 years ago, I think it was. And people were thrilled with us. There was a few negative things, and that's great because we could learn from that. But for the most part, community satisfaction surveys do benefit. It's just they have to be done right. And I actually would like to do one in the future, but that's a. And then officer performance. We do evaluations on every officer. Everybody gets evaluated, and we work through that to see what training deficiencies there are, and so on and so forth. Proactive enforcement. What happens to a police department in our position is when we're understaffed, we become reactive. Now, the Duxbury Police Department isn't totally reactive police department, but it very well could become one if we lose some more personnel. And that you don't want. Officers need to be proactive. They need to make motor vehicle stops. They need to do their building checks. They need to, these midnight guys that are out driving around, they do a lot of checks. They check the buildings. They do a lot, believe it or not, they're out hunting, however we want to say it, but it's all for the better. And it's important. Operational efficiency, public safety incentives, investigative efficiency, all these stuffs, clearance of crime, when the detectives are investigating something, we keep track of how many crimes are cleared, and that's all that adds up. Collaboration with other agencies. We always work with other agencies. We always keep, just like the fire department, we make sure we always have the backup, we back up each other. There's mutual aid in each town. Again, we have to be careful because, as much as we'll go to Marshfield, or Marshfield will come with us, they have staffing issues too. But for the most part, when the bell rings, police, just like the fire department, we're there for, it doesn't matter, we're there for everybody. Everybody's there for everybody. Budget and financial efficiency, traffic safety, incident analysis, and after action reviews. Another important one. Whenever we have a major incident, we do after action reviews, we do debriefings, we learn from our mistakes or what one officer did right, maybe say, hey, maybe we need to change that policy. So these are all things how we measure our services. And like I said, I can go into depth about this stuff, but I think you get it. I just want to conclude with a few things. Now, I have a few things here I want to just touch base with. But for the most part, the backbone of the police department is patrol officers. Without the right support, equipment, and training, we risk losing overall effectiveness. We no longer operate a 1970s police department. Instead, we operate a full-service, well-trained, and properly equipped force. We need to continue that and build this and strengthen the department to meet the demands of the Duxbury, town of Duxbury. It's that simple. So some of you may be aware of this, but back in 2022, we actually did a staffing analysis of the Duxbury Police Department. It's quite interesting. And it's quite several pages, a lot of pages actually, with a lot of good information. And some good statements in here from the agency that did the study. But one thing they did come out with is that the police department is understaffed. And they do mention, just like I mentioned to you, that if it's not addressed, that the Duxbury Police Department will end up being a reactive police department and services will be reduced to the residents of Duxbury. In this study, they actually mentioned that the police department needs around 6 new officers. They didn't account for a lot of the changes of that we did, the second SRO and stuff like that. So in reality, the police department needs the 2 funded positions that will be taken away if 2.5 doesn't go through, and 2 additional positions. So that's 4 officers. That'll give us a 4-sector patrol in town, which is what this town needs. And in that staffing study, it actually compares the town of Duxbury to a lot of other towns. There's like 15, 20 towns it compares to, and we are deficient. So, with that, I think that's all I really have. Oh, just to give you a quick little analysis, because I know this is going to come up. People say, well, how about your overtime? Now, you keep on saying you're filling vacancies. Well, how often do you fill vacancies? Well, when I first presented this to the FinCom, that was quite a while ago. So what I did was I took a period from August 1st to September 30th, 2024. And I figured how many patrol shifts needed to be filled because an officer was out either for whatever reason. Well, there were 225 patrol shifts that were filled with overtime. 43 of those shifts were left vacant because we could not fill them or order a person in. And so we ran light, which is not good. So there were 268 patrol shifts. That's 30% of the patrol shifts needed to be filled for that period of time. That's how understaffed we are. Yeah, so I know that's August and that's probably a busier time where people are taking vacations and whatnot, but that's just a snapshot. And questions? Sure.
Hi, Chief. And, for those who don't know, I've been a prosecutor for almost 14 years now, representing 20 towns and cities, not in this county. And I can say that I've seen a lot of changes, and what wasn't brought up was a lot about the change in the climate in the last few years, in the legislation and what the courts have required for our law enforcement. And it has equated to a lot of dollars and cents too. There's a big microscope on police and a lot of extra work that police have to do with respect to post. And as you talked about the crime reform and other cases have come down with police inquiry. And it's time consuming and it's costly. But I bring that up because there's something very important that you left out of your presentation that I think the public should know, and it should be a point of pride because like I said, I see a lot of police departments, and we are very, very lucky to have such a professional, hardworking police department that's accredited. Would you mind explaining to the public what your accreditation means?
Well, accreditation for a police department is huge. We've been accredited, we just got reaccredited under the sixth edition. There are, how many standards? How many? Over 300? 800? There's over 800 standards to get accredited. But what it drives it is a lot of the changes in law, reform, police reform. So a lot of our policies had to be adjusted. Our policies are probably one of the, they're state of the art. They are fine-tuned policies. And in order to get accredited, you need to have those fine-tuned policies. And we are an accredited police department. It took us close to a year to get reaccredited by fine-tuning all our policies and getting everything in order. And we finally just got the word the other day that we are accredited police department, which is huge. It's massive. Thank you.
Thank you and congratulations.
Thank you.
I'm gonna ask you the same question I did before. I think you answered it, but I think it's important. I believe I heard in your budget that the additional hires actually cover the costs that are associated with the overtime that you're paying now. Can you speak to that?
Yep. Again, overtime will never go away, but it will be reduced by having a fourth sector, because with police, it's a little different than fire. With police, if I have 4 officers on patrol and one of them's out, we don't necessarily have to fill that. Now, there's certain things that come into play. It depends on the time of day, it depends on the shift, it depends if there's a snowstorm out there or whatever. So there's a lot of variables that go along with that. But we don't have to fill it, so therefore we don't have the overtime. Right now, I have shifts that are already have vacancies on them. I can't just have 2 officers on the road, I have to have 3. That's like a minimum of 3 officers on the road. So I'm filling that with overtime. And when an officer is out, it's mandatory overtime right now. But if the 2.5 does go through and I do get my officers, that will reduce the overtime quite a bit. Also, too, just so everybody knows, there's a long process with hiring officers, and same with fire as well. To get an officer up and running, get them on the street, it's like a year between the academy, well, the background checks and everything before you can get them in the academy. Then there's the academy, and then there's the FTO, field training. It's a year, maybe even a little longer than a year, depends on how the FTO training goes. So it takes about a year to get an officer going.
Chief, are there any grants for like spam or anything like that that can help? I know it's more of a delay because you have to pay for the officers after the grant is done. But are there any grants available that could help our community out in the short term?
No, not right now. I haven't seen anything. I'm always notified of grants. Problem is, like Chief Reardon mentioned, the MBTA being turned down, our grants are also being shut down as well. So we do, just like the fire department, we do look into grants for different things, all different things, equipment grants, hiring grants. But right now, there really isn't much. And again, we're pretty much shut down because of the MBTA issue that has just gone through town.
Thank you.
Hi, Chief. We've been talking about costs that we're incurring. That's what a lot of this discussion necessarily has been. One issue I'd like to touch upon is cost avoidance. And I raise that in the context, particularly of policing. We live in a very litigious society. We all know, and your officers always have targets in their back every time there's a traffic stop, every time there's an arrest. Can you touch upon a little bit about the types of exposure that's out there, like civil rights complaints, those sorts of things that we avoid through having professional police officers adequately staffed? All the things we're talking about tonight that, yes, they're costs, but they also help help the town as a whole avoid lawsuits, lawyers, hopefully not judgments because we're not guilty. But I want us to think big picture on this sort of thing, that sure, we can nickel and dime on maybe certain things, but I don't want us to then risk having, somebody having a bad night, finishing their shift and having, a lapse of judgment that could potentially expose the town. So could you address that a little bit? Thanks.
Well, yeah, absolutely. I think the biggest problem with running light is not so much that, well, it is so much that, an officer could get hurt or the officer's judgment might not be there because the pressure is put on the officer. I mean, if he or she doesn't have a proper backup, then bad things can happen. And when bad things happen, then there's lawsuits. But it also goes to say that, it's so important to have officers on the street who are trained, who are in the right set of mind, who are well rested. We don't need officers who are tired, who their mind is just not there because they've worked so many hours and now they're being forced back to work. Those things go against us. And what ends up happening is bad things. And bad things in the police world end up in lawsuits or somebody getting hurt. And I think that answers your question, but for the most part, what helps is us being accredited. That helps us to the standards that we have to be at. And those standards, every officer has to abide by, so that's a good thing. However, it doesn't take away the fact that these officers will be, their stress levels could be up because they're overworked. And that creates issues, obviously.
I'd just like to. Just to get back to Amy's question about the overtime, and it was answered substantial. It's extremely substantial, because in 2024, it was 883,000 in overtime. Your request, for a level budget is 635,000. And with the needs budget, it's down to 519,000.
Yes. Yeah. So yes, it will be reduced, but it won't go away. It can't go away because there is mandatory overtime with training. I can't train officers on shift. Some of the training is done off shift, for obvious reasons. So therefore, there's overtime with that. And there is gonna be overtime for backfilling the officers. So the overtime never will go away. It will be reduced and it'll be monitored, trust me. As a chief of police, I will monitor the overtime.
Definitely, we do have one question.
Sure, go ahead.
It should come through the TV.
We have a question from someone that's watching this on Zoom that we're gonna read.
Christine Hill.
Hi, it's Christine Hill, 120 Washington Street. Can you hear me?
Yeah.
Yes.
Okay, so I've been talking to town employees, including at the fire, police, and DPW this week, who are extremely upset about the current budget, the 2.5% budget. They're calling it the shock and awe budget, and they feel like they're being used as bait to force the Proposition 2.5 override, because I think we can all agree, listening to the presentation and just being, understanding how things are at these two stations, that these probably aren't the places we want to cut the budget. And so I was just wondering if the fire chief and the police chief could talk about how the current budget has affected the morale at their stations, bearing in mind that I was told one department, I won't say which, every single person in the department is looking for a new job now.
Thank you. That's true to a point. It's my job to make sure that the message gets to them and that to reassure them that I'm gonna do whatever I can to secure their jobs and to make it a decent place. We worked a lot of years to get that police department where it is today. And This information that they've been hearing is very troublesome to some of the officers, especially the younger ones, because their job's on the line, plus they feel that, well, maybe I want to transfer somewhere else. Maybe I want to go to a department that's more secure. You know, if this is an issue now, what's it gonna be next year and down the road? You know, I'm young, maybe, I don't know, there's plenty of departments that'll take me, that's true. And that's what we're dealing with. It's my job to make sure that the message gets across to them. I communicate with all the officers and I reassure them that, you know, I'm gonna do everything possible to make sure that this department stays the way it is and that you get the support that you need. And that's pretty much all I could do. I gotta leave it up to the residents of this town. And hopefully everybody does the right thing. Chief?
Thank you for your question. Quickly address, I think I have my finger on the pulse of the department, and I don't believe that we have everybody applying for jobs elsewhere. I'll be honest, I think our firefighter paramedics love working for this town, as I do, and they understand that we are in a fiscally tough time. And what I've said to them is, please stay with us, and please give us a chance till March, and hopefully we are gonna get through this. I'm not gonna tell you that we don't have the bottom few who are out there putting their feelers out. They are, they have to be, and I would be too if my job was on the line. But I don't believe that's the case. The other thing is, there are layoffs that are affecting many, many departments, and I'm not putting the jobs of us or anybody else over any other people. These are deep cuts, and I've seen that on social media, but this is affecting across the board. And maybe there are some departments that have been spared, but I don't think this is a time to be attacking people. And one of the other things I'm gonna bring up is there've been questions of, are there other ways to cut? And that, have we come up with ways to cut besides layoffs? My department cannot function without the expense line items. So if I cut that, we're not gonna be emptying the septic. We're not gonna have the lights on. We need that to function. So unfortunately, the only option we had was to lay off people. And I can tell you, we worked with the finance director, the town manager, HR to come up with the best option that we could come up with. So we have been working, honestly, many hours trying to make this as palatable as possible in a very bad situation. And if I can just, while I have the mic, answer one of the questions the woman had asked about Norwell. I like to get facts, right? I just talked to the Norwell fire chief. So they have not hired a call firefighter to work a shift since 2002. They currently have 2 call firefighters. They have recently increased their staff to 6, which is what we have, and they do hundreds of less calls than we do.
Couple of questions.
No, this was many years ago.
No, I know you said it was many years ago.
What is
Give her the mic.
The call department is, so she's asking what's the difference between a call and a volunteer fire department. I'm not aware of a single volunteer fire department in all of Plymouth County. A call department means when you show up, you get paid. So we have a call department here, no different than Norwell. Norwell has 2, we have 2
I
firefighters.
was speaking of a volunteer fire department, that's the word I had used, not call. When I was a kid in Norwell, around the corner on Pine Street, it's still there. There's a building, it's a fire station. On snow days at 6 AM, the alarm there would go off, and I'd know if I had a snow day or not.
It doesn't exist. That's all gone, that's all changed. I just wanted, because
I'm no expert in fire safety, but I will tell you that I did work for the state for a couple of years and traveled across the Commonwealth, working with many, many communities. And I can tell you that in the western part of the state, where it is much more rural, less densely populated than areas on what we call the East Coast, there are some communities that do still see a volunteer fire department, but that is unheard of on the East Coast, where things are much more densely populated, many more buildings, population is much more dense. So when I've been out in the Commonwealth, I have not seen it on the East Coast.
You can open mine up before.
anyone else?
Hi, This is my first time at a town meeting in Duxbury, in Massachusetts. I'm not from here. So I found it interesting, and I found it surprising. First, I have to thank the fire and the police. I've had to use your services, small things, but you were there, you were.
Thank you.
You did great jobs, protected my family. I can't ask for more. While you're talking, because I have a long business history of corporate solutions, I started writing down things you might consider. And then I decided, you do consider them, you don't need me to tell you what to do or how to do it. But I am concerned, as a person, as an individual, as a citizen, I have a budget. Every year I look at what I'm gonna spend. And the things I do not touch, do not even consider, are my health insurance, my safety, my security systems. Those kinds of things don't ever impact me. Everything else after that, I have to look for cuts. I never come to this space, ever. And I'm really sort of embarrassed and upset that we're at this point, that we're having our safety net coming and asking the citizens of the city to vote or to support additional income. I should ask me for money for water fountains. Okay, that's something we can talk about, but not our safety system. This is wrong. It's just, I think this is wrong.
Thank you. If you'd like to just come to the podium, please.
Should be on.
I don't think you turned it off. Yep. good.
I'm not a good speaker. And Shaughnessy, King Caesar. Just want to say I appreciate our departments. I am a registered nurse. Just bear with me. I don't know the answer to this question. My dad in the 80s and 90s was a Plymouth County deputy sheriff. And I know that he used to have to watch people in the hospital or go on hospital runs and go into bust and stuff. Do we still use the Plymouth County?
We do, but it's limited, like, they can't watch a prisoner that's in our custody until after they've been arraigned in court, and then they can take over the custody. But we own them until they are arraigned in court, we own them. Unless they go to the House of Correction, so that if they do go to the House of Correction, if they take them, then we can send them to the House of Correction. But if somebody can't make bail or whatever reason they're in custody, we own them.
I think it was probably from Plymouth County that he went. So, just a little comment, and I may not be as educated as everybody else, but with the MBTA thing, and it does seem like they're trying to punish the communities that have voted it down, which I think is a great justice.
Okay.
And especially with, like, just the other night, Needham, because they approved the initial smaller scale, and then the state just came in, tried to override it, make it much bigger. So I don't think that is fair either. That's my own opinion. But also that obviously we allow more people to come in an influx, then we're going to need even more services and we're going to even be more drained. So that's just my own opinion. And thank you.
I back the blue. And back the fire department. So I wanted to ask, you are projecting a pretty big uptick in calls for next year. And I'm wondering, you're data driven as the fire department. So what are you basing that on and what type of calls are you seeing? What's the difference in the calls and the severity? So I'd like you to speak to that, please.
Sure. The calls have been rising yearly. The reason why I say that they're gonna be close to 30,000 is because just in the past, they have risen over the years. Now, the calls that we do get now, whether there are a lot more violent calls than there have been in the past. But the situation is the calls take time. They take time because now police officers, look at it this way. A police officer back in the day was a peacemaker. Keep the peace. Now they're problem solvers. They go to a call, mostly two officers, go to a call, and they're there to try to solve the problem. So there's the time involved that these officers spend at a call. So there's that, and as far as call volume goes, there's just a wide spread of calls. It could be anything from an alarm call to, somebody being beat up. They're just the calls or somebody dealing drugs, or whatever it may be, that the calls, there's no like more calls than others. There's just a wide selection of calls.
Follow-up.
Sure.
So, I guess can we talk about Island Creek? Can we talk about the number of calls that are over there? And are there certain sectors in town that you're seeing an uptick in the calls? Like, I don't need to pick on that. There you can talk about my apartment complex. You can talk about my neighborhood. Are there certain sectors in town that you're getting more calls on? And what can we do to be preventing that if we can? Because I know that's the objective. Let's not have any calls or minimize it. And what can we do?
So with any high density areas, you're gonna get more calls.
Right.
It's just that simple.
Right.
So, yes, there are more calls in higher density areas. The calls that we get there, yeah, they're serious calls, but they're more because it's high density. We may get the same level of calls on some other part of town, but less because it's not a high density area. See what I'm saying? So that,
Oh, I see what you're saying.
Yes.
And I see what our governor says, that we need to have more high density housing here. So I'm just saying, let's connect the dots.
well, high, with more, exactly. I mean, higher density, you're gonna get more calls in that area.
I can answer you from the fire perspective.
Thank you. All set?
The cheapest.
Oh, I'm so sorry.
Try something else.
Yeah.
I'll be quick. The Island Creek, so again, we're data driven. 232 calls we responded to last year for that complex. Again, why? It's just as the chief said, this is the same thing. Denser population, the makeup of this town has changed. And if you look across the board, if you look at the facilities that have been put in, I've been here for 24 years. We've put a lot of facilities in that draw our resources, and we need to respond. So we do see a higher call volume in dense populations.
Right, I mean, if there was a development that was going in that was gonna have 20 homes in it, you're gonna get more calls in that development than you are on some street that has 3 homes on it. You know, so, but I know what you're saying, the severity of calls may be more than others in areas and so on and so forth.
I don't believe you're asking for
We'll always be there for you, trust me. These officers are dedicated, we've got them dialed in.
And one other thing to remember is the needs of the town have changed. I talked about it, you're over 60. Think about this for a second, you know, someone will question, well, why'd you respond to the bloody nose for the 80-year-old? Well, that might be an emergency for the 80-year-old, but for us younger spry people, you know, maybe it's not as much of an emergency, right? An emergency differs on who that person is. And when they call the police or fire department, we don't, it's easy. You call 911, we ask you 2 questions. We might ask a few more, but we need to know where you are, what your emergency is. Neither one of us make you fill out a form. We count, we respond, no questions.
Yeah.
And our goal is to make your day better. We show up on your worst day.
Exactly.
Thank you,
Well
guys.
said.
Appreciate it. We're going to move on to facilities. We have a new facilities director that is speaking with us tonight. She's on screen. Katie, would you like to take it from here on the rest of your department, please?
Betsy, can you give me 1 second to pull up her slide deck?
Oh,
I'm
give
not
us a
here.
sec.
I apologize.
All right, Katie, go ahead.
Okay.
Hi, I'm Katie St. Clair, the facility director for the town of Duxbury. You can go to the next slide. I oversee the facilities for the town. So that consists of 63 buildings over 850,000 square feet. We have to ensure the safety and comfort of over 1,100 employees. We have 267 HVAC units, 548 sinks, 803 toilets, one maintenance man, and one HVAC technician and myself to manage those assets. Functions of our facility department is anywhere from roofing, locksmith, general repairs, HVAC, preventative maintenance. We have a backlog of work orders and things that need in repair due to budget restraints and lack of employees. We had last fiscal year, we had 2,704 work orders. 80% of those work orders came from the school department. We've seen a 9% increase in work orders since I began. And we expect this to increase throughout the year. And then out of 105 days, we only had 69 days that we were fully staffed in the facilities department. And that's due to vacation, sick, personal. And part of the reason that I bring this up is in the instant that one of the guys is out sick and the other guy is on vacation, that leaves me to 63 buildings. So again, it goes back to police and fire. A lot of the calls that we get are, I smell gas, I smell fire, you know, a window's broken in the middle of the night, with one person basically managing that and overseeing that. So we have to call in resources of other departments and other outside contractors. So this year I'm asking for a maintenance manager and an administrative assistant. We are looking for very little grants currently in outside funding due to there's no time to look for it. We are strapped very thin. We would like to reduce the need of outside contractors at prevailing wage rates. To give an example of that, we did a big bathroom remodel job at the Alden Elementary School this year. It was a little over $150,000 project. Our maintenance guy was able to save $40,000 in the project by doing a lot of the stuff himself. Unfortunately, we missed out on another $23,000 that we could have saved by having him do additional things like painting and minor maintenance repairs to those bathrooms, but we had to outsource them, which cost us $23,000. We're doing very little to no preventative maintenance, which is going to cut the life of our equipment in half and our buildings in half. We don't have the money to do the preventative maintenance or really any maintenance. And we don't have the staffing. We need to pick up our general maintenance around the properties. We respond to the needs of the town 24/7, 365. Having more staff would cut these emergency calls because we'd be responding and reacting quicker and be ahead of the issues. Would increase the efficiency by reducing the time between the request and the response. As I said before, if 2 of the 3 of us are out, that response time is slow. And I think communication between facilities, the community, and the departments need to improve. I do my best at trying to tell the other department heads, hey, we have this going on in your building. But there are times that it slips through the cracks, and I would like to have the community know what the facilities department does and who we actually are. I'm not sure that everybody in the town even knows what facilities does. I think some just think that we're a bunch of janitors washing the floors. And we need to increase the proactivity of our facility director. The time is stretched, as I said before, and you could get a lot more use out of me if there were more people on our team. One thing that has been brought up to me several times is we need to get some engineers out. We need to do an assessment of the buildings. We're beyond that. We have had at least 5 assessments that I've found since 97, and they're sitting on a shelf. We need the people, we need the money. 70% of the facilities budget goes directly to state mandated building requirements, such as fire alarm inspections, elevator inspections, pressure vessel inspections, which that means boiler inspections by the state, so that's where we're at. We also need to increase the funding in the department. The current funding, we're spending more. We had this wonderful ARPA money, which ended in December, and we're under budget. You know, we're over budget every year, and we really need to increase our budget by $1 million to maintain, and that's to catch up on past maintenance and continue being proactive. And any questions?
Yeah. Well, welcome, Katie. We're glad to have you on board. I wish we'd had an opportunity to meet you in person as a select board. You know, and I can clearly say that none of my questions anything poorly about you all heard wonderful things. This seems wildly inefficient. What buildings are you responsible for? You said 80% of your calls are for the schools or work orders.
So 80% of the work orders. So let me be clear. Any employee in town can put in a work order. So that work order could be anywhere from I have no heat to I want a picture hung on my wall. We did a big push this year, and part of the reason that we're seeing an increase in work orders is because Duxbury's had a big change in employees, and the facility department wasn't pushing the work order system. So I pushed out emails to say, use this work order system, because that way we can address your issues. Otherwise, you're going to send me an email. If I'm getting 225 emails a day, there's a chance I'm going to miss that hanging the picture. I'm not going to remember that you want your picture hung. It's not my priority. So we did see an increase in work orders because of that, but also, I mean, it is what we're doing is we're scraping by.
In the schools, they have a janitorial staff. What piece of these work orders is done by the janitors and the staff there?
So we actually changed how maintenance is done through the schools. It used to be fully on the maintenance and facilities department. Now we have created any school staff, that work order goes directly to the head custodian, and that custodian and his or her group, figures out if they're able to do it. Now, in the meantime, I can see all the work orders. So if it is something of a safety emergency, or you need a license, I'd like a trade license to do, I'd intervene. But a lot of them on the school side are now being taken care of by the custodians themselves, because it's, hanging a picture.
So how does that square with this 80% of the work orders are still for the schools?
Maintenance in facilities spend 80% of their time, definitely 80% of their time over at the schools. 100%, we spend 80% over there. You get bigger buildings, there's more equipment, I think it was the police department was talking about a community that has, there's a lot more people in one area or town, so he's getting a lot more calls. Same thing in the facilities world. If I have over 100 pieces of equipment on top of the high school roof alone. So that's, figure 25 rooms are tied to a piece of equipment. That's a lot of calls.
Now, I know you mentioned that some of the projects require a license and of that nature. And I don't know your background and what other towns you've worked for, but is there anything the select board could do or a committee that could be set up where the public, the town could help with some of these projects? We have a lot of people in town here that would be willing to roll up their sleeves and help the town save some money with some, minor, like a gardening project or something like that. That might be time
We don't need
consuming.
more gardens, because that's more for us to maintain. But if there isn't a licensed electrician that wants to reach out to the building department and pull a permit for us to fix some lights that are hanging out of the ceiling, I am open to it. We do have a process. They have to be quarried to work in the school. They have to be fingerprinted in the school, and approved before they can work. But if there is a community member that wants to volunteer, this year I reached out to the senior center and we got some folks for a tax write-off program. They're going to be working in the facilities that have extensive backgrounds. So we're excited to have those folks with us. So I'm open and looking at opportunities and ideas on, where we could get, use some resources that wouldn't cost us anything. But we're in bad shape financially.
Hi, Katie. It's nice to meet you. This is Amy. I am interested in the 2 new full-time positions. It's my understanding that the maintenance manager would be actually doing some work, some hands-on work. They'd be doing painting. I think you said some other actual physical work that the maintenance manager would do. Can you help me understand a full-time administrative assistant? Right now, there is no administrative assistant for your department. What help me understand the need for a full-time administrative assistant?
So that would free me up to be able to tackle other things. So I spend about 4 hours a day between invoices and purchase orders and contracts. So it could help me relieve some of that time spending on that stuff. We're kind of trying to mainstream all of the buildings so they're all run the same way, same vendors. So getting some of that information and data together, like I said, to improve the communication with the department and other departments and the community. That is not happening. And also that she or he would be able to do the work orders. So check off the work orders, input the work orders. So the work order system also can track budgets and what we're spending on different repairs and different equipment. That is not being utilized. There is no time left in the world to input any of that information. So we're not utilizing the work order system the way we could.
Katie, do you mind if I jump in? This is Mary.
Sure.
Excellent. So one of the things that I want folks to realize is Katie is a very welcome addition to our staff. She is highly skilled. She comes from another large community, and she is very, very much hands-on. And I don't want to speak for Katie, but my guess is that she would rather be fixing mechanical parts than all of the clerical administrative work that she's required to do. A huge part of her job is to deal with Chapter 30B, which is procurement. So as a municipality, we are subject to very stringent procurement laws that govern the way that we buy things, whether we're buying goods or we're buying services. And if Katie has a repair that we estimate is going to cost about $12,000, that all of a sudden triggers her to spend an inordinate amount of time chasing down vendors who supply that good or service in order to gather quotes, compare the quotes, prepare procurement documentation to prove that she has performed the Chapter 30B procurement, manage that within our accounting system, provide that to the accounting office to get approval before she's able to enter a requisition. The requisition then has to turn into a purchase order, and then Katie is able to schedule the work. So there is a high level of administrative clerical function that happens across all departments, but it is much more apparent and visible in a department like Katie's. She has a million moving parts. You saw that she has a million projects that she faces, and having the support to do the administrative functions, schedule vendors to come out and walk sites in order to prepare estimates. It would be a far better use of time for an administrative assistant to schedule and coordinate those meetings and give Katie the ability to get her hands dirty and do some of these projects that she has in front of her. So that's the real need for that administrative assistant.
Your explanation doesn't sound like administrative assistance as we think of an administrative assistant. It's more of a providing technical support to Katie, right? So for me, what really resonated is the most ineffective and most costly maintenance to do is reactive maintenance. All right, and the only way you can stop yourself from doing reactive is maintenance by doing preventive maintenance, and Katie can't do preventive maintenance. And I think what we'll see is by her able to get into the preventive maintenance side, we will see those costs go down over time. So it's almost like overtime. It's the same thing. You're reacting. That's why you have overtime, because you currently can't do your preventative stuff, right? So if we do this, I feel confident that we'll see a reduction in our overall cost, the expenses to maintain all our buildings.
In extending the life of our assets.
Exactly. If you have to, we talked about the HVAC equipment, you have to replace it. I mean, that's big buck money because we cannot do the preventive maintenance. It breaks down and we have to replace it.
You have to
rather than
plan,
repair it.
right? You have to plan.
Yeah. Sorry, I'm an operate and maintain guy, so very passionate about maintenance. Yeah, I'm done.
Okay.
Thank you.
Yeah, if I could also add one other thing. So Katie has talked about her utilization of some resources through the senior tax work-off abatement program, which is fantastic. There are a lot of folks in town who have a lot of skills to offer. But you are probably also aware that we have a limited number of participants who are able to participate in that program due to funding. So right now there's about 25 folks who are participating in that program, and those dollars are numbers that are in our budget in order to offset that tax abatement. With the override budget, the contingency budget that we have been presented with, there is an increase in order to allow or be able to allow about 16 additional people to participate in that program. So if we are able to successfully pass the override budget, then having the opportunity to bring more people into that program and provide those services and provide the tax relief for those folks would be beneficial to everybody.
Hi, it's Brian. I understand where one of the goals of the department is to insource more work. And I understand you can outsource, insource, and it's about what's most efficient. The question I have is as to maybe cost shifting when we're able to do that. And I say that in the context of warranties. We have lots of equipment that were either installed by others and certainly manufactured by others. They typically come with warranties. They break down. We have to get them fixed one way or another because we need to run the facilities. My question is with respect to staffing up this department, which is what the request is, will that have any effect, or will that help us go after vendors in warranty claims, and will it allow us to either get third parties to do the work, or that we can get compensated for work that we have to pay for? Thank you.
It absolutely would. You'd have more eyes on it. You'd have more tracking. Yep, you absolutely would have, that would be a benefit of the department.
Anybody in the audience?
Oh, there's somebody on, Zoom. The moment while we bring it up.
While we're bringing it up, is there anybody in the audience that had a question?
There we go. Hey, Christine, you hear us?
Apologies. So what I just wanted to ask was, and maybe some other people in the committees can help. I remember we added this facilities management position at about the same time that we built the new school, and it was a big deal, and it was supposed to solve a lot of problems, and we had not had one for before that, and maybe I'm wrong there, and I'm just wondering why 10 years later we need more people. So first check my facts, and then you can answer my question.
Is the first part of the question, Christine, did the facilities manager is a position that we added? I think it's more than 10 years ago, but.
Around 2014, when we had the new school, we said we're having all these new buildings. We need a facilities manager to keep track of all these buildings. So we'll get a facilities manager, and we did it. And so we did that instead of, like, I don't know, 30 years ago, my father used to hire electricians for the high school. Okay, so now we have this facilities manager. We've had this position for maybe 10, maybe 12 years. And then after only 10 or 12 years, we need all this extra staff. And so it just seems like a lot of growth in a department over a short time.
So.
Maybe,
Sure.
Okay.
let Katie answer, she knows.
Oh. Katie, do you want me to jump in, or do you want to jump in first? Feel free.
Katie froze?
Katie's got the-
Oh, so she, okay, she went, all right. So I just want to highlight a couple of things, and I certainly was not here 10 years ago.
I mean, I can jump in with,
Oh, go ahead, Katie.
No. Sorry, my internet connection is bogus. So what 2013, the facility director is it
Oh, goodness, you're choppy.
Her internet.
Yeah.
created. I don't,
Katie, this isn't working, you're.
Yeah, maybe somebody like Friend Wheeler could comment, because I think he knows. It sounded like he was nodding and he knew about it.
Mr. Weiler?
Thank you, but I'm no whiz on this. I can tell you that I was one of 3 members of the finance committee that was empowered this year to work directly with the facilities director. When we were asked to sit with Katie and talk about her budget, talk about her struggles with trying to keep up with the, I don't know what the value of our property in town is, $100 million worth of buildings. The facilities department was founded, as you said, maybe 10 or 12 years ago. But frankly, we've been underfunding her budget, that budget, to 2 previous facility directors, I think, left in frustration partially. We're on our 3rd one now because we weren't providing enough money each year. This was one of those departments that was at the end of the line when it came to funding. We talk about public safety, we talk about our schools, we know our priorities, but this large investment in property that we have has not been addressed properly. So we probably should have funded it better at the get-go. With that much property, if we throw $250,000 a year at it, as Katie pointed out, we're only covering the mandatory inspections that are required in all these buildings, with pumps and other things that have to be inspected annually. So we're now trying to build that budget up for her, giving her the staff to get to all these different projects, to try to, in the end run, save us money on our buildings, so we get the normal useful life that we're expected out of equipment and buildings that we weren't getting. This was addressing a criticism we had at town meeting, that we weren't keeping up with our property. And we just are finally getting around to recognize the need that we have to fund this better than we were funding it.
I'd like to underscore that if I could, and in support of what Fernando had said. And I'll give you a concrete example. We are guilty as a town of underfunding maintenance, that we are one of 351 guilty entities who underfund maintenance. Every time we need some money, we underfund the maintenance budget. When I ran for selectman, having my usual knowing nothing, I got friends of mine, one an architect, one a builder, to go through the old high school. I was of a mind going in the door that we could spend some money and rehab this and have high school back in order for another 50 years. I came out the other side saying, this building can't be saved because the maintenance was so bad and so let go over the years. We're doing that all over town. We have 63 buildings, I think, Katie said. And guess what? The maintenance is being sloughed off on all of them. We had tonight where if we had to cut things out of the budget, maybe we don't clean out the cesspool, and save a few bucks. No, I don't think we're gonna be able to do that. And so it's time to, to stop trying to skin the cat. We've done a great job. We have phenomenal, professional staff who have cut all of the fat potentially out of our budgets year after year. We're down to the nitty gritty now. It's time to pay the piper and do the right thing. And maintenance is just one element. Fire department, police department, school departments, we need an override, period.
Can I just have a follow-up? Just the follow-up would be whether we need more staff, or I've been hearing a lot from people and what friend Weiler said, we're not spending the money on the little maintenance things. Like I've heard people about specific buildings, we're not spending money that if we spent it every year over time, we would end up in a better position. There is that question, and then there's a staff question.
So to that point, you need to have the staff to execute those projects. So we need to have the staff to go out and do the inspections on our properties on a continual basis. And then when they identify those issues, marry them up to work orders and are able to actually address them, you need the hands and the boots on the ground to actually implement the solutions. As Katie mentioned, over the last 18 months, we have utilized and leaned heavily on ARPA funding, which has been federal relief funding provided to communities across the country. We've invested over $500,000 in facilities issues, more than that, I should say, because we're trying to deal with leaking school roofs. We're trying to deal with HVAC issues, and we're trying to deal with a myriad of other smaller projects. And to your point that you raised this 10-year time span, the town may have created this facilities department 10 years ago with the best of intentions. But one of the first things that I noticed when I got here, is that it has been chronically underfunded. About 80% of Katie's budget, actually, I think it is exactly 80%, as she quoted earlier, is spent just on minimum requirements that we are required to do on an annual basis that include inspections and some minor maintenance. She has very little discretionary funding to do anything beyond that. We've spent ARPA funding to do things like replace benches over at Percy Walker Pool that have simply rusted out in the locker rooms. We're trying to replace the boiler over at Percy Walker Pool, because in that kind of a facility with the humidity, there are things that rust faster than expected. So over the course, maybe 10 years ago, when you created this department, those things were not rusting out, but they are now. And we need to have people, the staff in the department, to go through all 63 of these properties on a regular basis to do safety inspections and to do preventative maintenance inspections, and then be able to prioritize the work in relation to the funding that's available. It's crucial. And prevailing wage, for anybody who is familiar with it, prevailing wage costs us 3 and 4 times more than normal, or more than we would expect, in order to address problems. We have people who say a lot of times, Why can't the town hire a painter? It only costs me $2,000 to paint my house. Why does it cost us $5,000 to paint the same square footage of the town? It's because we are subject to Chapter 30B requirements, and we have to pay prevailing wage for those projects. And so inherently, it costs us more, and our dollars don't go as far as the dollars you have in your home. If we were to have the staff to be able to tackle some of those projects internally, then we would be able to stretch those dollars further. We would be able to effectively manage these projects, and we would finally be able to make a dent in the work order load that Katie is facing.
All right, we still have, I don't think so. There's nobody that had a question from the audience, right?
We still have.
Okay, so we still have two presenters, and, we have, Jim, why don't you wanted to, address the change from, the balanced budget to the, contingency budget and the impact on your department?
Well,
And then Jake, we haven't forgotten about you.
that's cool.
Good evening, everybody, and thank you for all your hard work here. Really appreciate it. I'm amazed at the level of integrity in this town and how many people come out to volunteer and have interest in what we do. I came from the private sector, and I'm only here to give a small little talk about the small impact I have to my department. For those that don't know me, I'm the building commissioner, municipal services director, and in my department, we deal with all the permitting, the building, and the health department is in my purview. So we're only looking at what compared to what we're listening to for public safety, we're a big public safety facility department that we're unrecognized really, because as a good friend of mine said, you'll never see a memorial of a health agent or a building inspector, but we have a big safety. When things are done right in buildings that we permit everything that happens in this town, nothing happens, which is a strange thing to say that we do nothing, but nothing happens because we try to do our absolute best to regulate that stuff. So we're looking at a small cut of a part-time person that is in our health department. And this is such a key critical role that we have in that department that impacts, we also process all the liquor licenses in town. It's an administrative task. It's very daunting at the end of the year. All the food licensing that happens. This small task is a key role that makes our team work well. Without that, when I was asked that question, how can you do this without that? And my answer is, what do you not want to get done? Are we going to not be able to provide the services as quickly as we want to the public? That is not how I want to operate. I came from the private sector. I've been in the municipal work for 10 years. And the one thing I realized when I got here is I did my own budgeting every year for my own private sector. When I came here and started doing the budget, I was absolutely shocked at how thin and small and finite we are in how we manage things. I have no wiggle room in any part of our budget. We don't have the overtime issues that the staff does, fire department and police. But, and for that reason, we don't have any flexibility in how we get things done. So this small role that might look small and inconsequential is a very important key role to our department. Some of the impacts to that we would see or deal with is, one of the big ones I'm highly concerned about is my staff. And that is asking them to take on these additional roles that this person does. When I've got a health inspector that now has to do administrative tasks and can't go out there to inspect apartments that need to be changed over, food inspections for restaurants, campground that needs to be inspected. All that stuff now has to come into an administrative task. That person also has a dual role where, they process all the meetings for zoning, right? It's kind of a weird unicorn hybrid role. But now I'm asked that person now has to take on those duties, as well as my lead health agent would have to take on administrative roles like processing all the permits, all the septic stuff that we have to process, the scheduling of meetings that have to happen in the department. The administrative role is kind of interesting because we look at it like there's some requests to have that in their department. And me being self-employed, being a jack of all trades, I worked 80, 90 hours a week. That was the way I ran my business. And in a municipal service department, people don't work like that. You know, they're gonna come in, they're gonna do their job and, you know, have a work-life balance, as we've heard today. This little administrative role is such a key thing in our department that honestly, I'm really still drawing a blank. I've been trying to brainstorm how I can do this without it. And the answer is I can't. You know, I know one of the big things we do is some years ago, the liquor licensing administrative tasks to process that is in our department. It got moved to our department and we took it on. This is before I was there and now we're managing that. That role, we can't process that anymore. I don't have someone that can do that. That's gonna get kicked to someone else. And I don't know who that's gonna be. It doesn't seem that big, but when these restaurants need to make a living and we're holding up their liquor licensing process, that's not a good thing. And that happens one time a year. It's a multi-month process to make happen that is coordinated between the ABC and the town and the select board members all have to go through that process. It's a big process. I don't know who's gonna do that. It's kind of frustrating and I feel a little small compared to what we just witnessed and hearing from the other departments about the needs that we have. But this particular need and the detriment if an override doesn't go through, I get concerned that we're not going to be able to serve the public in a manner that this town deserves and expects. And that's kind of the short story of where we're at. And I'm open to any questions if anyone has any here. Sure. All right, good, how are you?
Good. Understanding that when the budget went around, you had to make some choices about how to do a cost to restore, cost to do a level budget. Could you give the public and us an idea of what your org chart is? Like who you're responsible for? Because I was a little confused about why this is health.
Sure. Yeah. So within my department, I think you just want to run down what that looks like. So within my department, I have myself as the building commissioner, zoning enforcement officer, and the director. My three roles. I've got a full-time building inspector, a part-time building inspector. I've got a part-time electrical inspector, part-time plumbing inspector. I've got 3 alternates that are on call when they're on vacation or they get a sick child or whatever, that we don't pay unless they do work. I've got an office manager. I've got an administrative manager on the building, administrative assistant on the building side that's full-time. I've got a health inspector that has a dual role as my ZBA zoning board administrative assistant. I've got the one that's the part-time is the health department administrative assistant. And then I've got a health agent. So I think that's the total rundown here.
That I remember from the COVID days, there was also a part-time employee for all like infectious diseases and things. Is that falling off the budget?
We still, thank you for reminding me. We do have a public nurse that we still have on staff that deals with infectious diseases, you know, rabies inquiries and things like that. So that person is still on staff.
Is that an hourly or is that a salaried employee?
That is an hourly person, you know, it varies depending on the demand.
And which of these persons would this 30,735 account for?
That would account for the administrative assistant in the health department side.
And what's the 1757? The other expenses that you're asking for? It says a mileage stipend for an assistant inspector.
Oh, thank you. So in another request I had in my budget was that I wanted a vehicle for my full-time inspector for a long time. I wanted it when I was doing it because of the professionalism that happens in that role. But I listened to the, the noise going on in the budget and said, well, let me come up with a solution that will make him happy because he uses his own vehicle. He's my high user. And so every person in town that uses their own personal vehicle, specifically in my department, conservation has one in others, they get a stipend every year. That stipend has never changed. It's a tax stipend. It's $300 a month. Taxed, about $240, $60 a week for fuel and use for a personal vehicle. So what I suggested and asked for was I tracked the mileage, average mileage over a 6-month period, about 35 miles a day. And then what I did is I broke that down to the actual number of days used, took out for vacation time and all that kind of stuff, and budgeted out what based off, actually it was last year's federal tax rate for mileage, and said, this is more appropriate based on the data that I had. So that was a request that I asked, and that was just for my high-end user, which is my building inspector.
That was the IRS rate, Jim.
Yeah, IRS rate. Yeah. Thank you.
Which has since increased since your calculation.
Yeah, it's 70 cents now.
It goes up every January 1.
That's right.
Good.
Any other questions? That's okay.
So doesn't your department generate revenue from your
Oh,
service?
yes, yeah.
In most instances, you just increase your revenue to cover your costs. Why do you have to get involved with the budget process?
A lot of his fees are set by the state, so we don't always have the ability to charge whatever we wish.
Yeah, but you have a finite audience for your services, not the town of Duxbury.
Right.
So those that are using your service. And if your budget is short by 15%, theoretically, you raise your income as a business person.
Right.
Cover that, and so I'm
I can
trying to
speak
get
to
this.
that.
How does this work?
I can speak to that a little bit. So as we know in the building world, it's very cyclical, right? We have great years and we've had some great years. And then we've always covered the budget through those great years in my department, which is labor. And then in slower years, you might not cover the budget, but generally speaking, we hover right in that realm where any additional funds go into the general fund to support the town, the other fees associated with the top department that I don't see, the building that we're in and all that kind of stuff. But generally speaking, our fees, we have some flexibility in creating and evaluating fees, and we look at other towns to see if we're in the same ballpark. We kind of look at how much time it takes us to do our job. We cover, our fees generally cover our expenses within my department.
But can I speak to that?
Sure.
I need your mic.
Oh, read the mic.
Thank you. So just for clarity's sake, any dollar raised in revenue by a municipality is required to be deposited in as general fund revenue and is not allocated or earmarked for any department unless there is a statute otherwise. So all of the funding that we've talked about here tonight for police or for fire or for inspectional services, that is all general fund revenue used to support the overall budget. It cannot be earmarked for a specific purpose. So if Jim's department were to raise fees, it would generally cover the entire budget. It cannot be allocated.
It can be identified, I mean, in this thing here, where I put it, there's a line item for what his cost is, right?
Correct.
And that is then a lien on the general fund to pay it.
Every single department is, and there are many departments in our community that are not revenue generating. Inherently, in the nature of those departments, not every department generates revenue.
So he's forced to get an increase in the budget.
even if he had money to cover it.
Correct. He's on the same playing field as everybody else. Correct.
But just to further confuse you, we also have the fiscal advisory board, which is not here tonight, who works on setting the fees with the select board. So there is an annual review of the fees that takes place, and then those fees are adjusted to cover the expense that is incurred. So it does work its way back through, but it's not as simple as a P&L where he can say, oh, I need to charge an extra X number of dollars. It has to go through discrete processes.
But theoretically, if his budget with raised fees covered the cost of the increase he's asking for, theoretically, that would be funded.
And no one is saying that those fees aren't going to be looked at, but when you're doing budget building, you can't offset the budget with an actual fee from that department. You have to just look at the costs of the department. And then the fees are also looked at by another entity in the select board.
Thank you.
I just want to comment on one other thing about fees in my department. The fees in my department are based on value of construction. So what has happened over the years is my revenue that we pull in is based on the revenue. And what we do as a discretionary bylaw, we request backup on what the cost of these projects are. I mean, you know, everything is twice the money in construction now, probably more than that. So the values of the projects that are coming in generates additional revenue for us, which goes to the town.
You're in bonanza time.
Yeah, well, you know, sometimes I wish I was still building through that time.
Somebody else wants to mic.
Yeah, sure can.
Just, something, if you were to lose this person, something you could think about is, the seniors. The seniors volunteer, I believe, in the assessor's office. You wouldn't have to give out all, you said it was pretty
We have them.
administrative. and
We use them.
Oh, you already used
Yeah.
them? So.
There's one in there right now. Well, not right now, but yes, we already do that, yeah.
And, so you wouldn't have to give out all those tasks out to your existing staff that would be staying.
There are a lot of tasks in that administrative position that someone to come in and learn that process on that small part-time, you know, we get them for, I don't know the exact number of hours we get, but we already utilize them, and we have them come in and do filing tasks and organizational tasks for us. I already, we started doing that last 2 years ago.
I was an intern in the Norwell assessor's office in summers. I did rebates for excise tax bill.
Yeah. My health inspector worked to get an intern, but by the time we got through the whole process of background checking and all that, the window for the internship, I think we had them for a week. It took months. It's a big process. Yeah, we have to, we're public figures and we've got to be vetted in. We've got a big interest in this town, so it's a process. Yeah, thank you. It's a great suggestion. But when I heard about the senior work-off program in our department, I immediately snapped on it and said, yeah, let's bring them in to help us out. And it's not because, I mean, we just have, we're so, it's amazing to me how streamlined we are, and to lose this little key roles is, I don't know what will happen with that. We're hoping that people understand that, you know, they wanted a certain quality in this town. They wanted to keep it more residential. I enforce the zoning bylaw, which is the big scope of what this town is. And that is my responsibility, to make sure that every project that comes falls in the guidelines of what the zoning bylaw is, which was created by the people of the town over the years. So here we are in this town, and costs have gone up, and yeah, now it costs more money to do business.
Thanks, Jim.
Thank you.
Thanks, Jim. All right.
The mic to Jake.
Yep. Jake. Last but not least.
Hey, Jake, you're looking pretty smart tonight.
This is our harbor master that had a small change to his budget and needed to come in.
Thank you all very much for sticking around.
to hear what I have to say. Yeah, I'd like to say that. So. Okay. I'm Jake Emerson, I'm the Duxbury Harbor Master. If you go to the next one, if you don't know what we do, a lot of people don't necessarily rely on our services all the time, but we are responsible for the search and rescue, boating emergencies, enforcement of boating laws, moorings, wait lists, provide navigational assistance, and we manage all shellfish, wild and as well as farm shellfish and maintenance of the town pier. Next slide, please. This is what we were talking about with revenue. We are one of those departments that does generate a good amount of revenue through the fees that we charge the users. I won't bore you with the details, but we have over 1,000 moorings, over 1,400 people sitting on wait lists, excise. We get a percentage of that. The rest of it goes to the state. So that's our percentage from 2024. Agriculture fees. A lot of these fees are set by state statute. So we can't raise them because we think that it would be a lot better for people to pay more to cover the incurred costs. We don't set those. So we are stuck by state statute. And then we also have the recreational shellfish licenses and the commercial shellfish license. So that's a $403,000 receipts. I'm sorry, receipts. So this is just the salaries line. The town of the harbor master department is made up of we only have 2 full-time staff members, an administrative assistant, and we rely very heavily on part-time seasonal staff. That's where a majority of our workload is covered in the summertime, or I'd say, there's six months that is really heavily reliant on part-time seasonal staff. And then there's the CVA, which is the Clean Vessel Act, because Massachusetts is a no discharge area. So we provide with federal funding that's distributed through the state. There is a because we provide a pump out service to every vessel so they don't discharge their boat heads. Yeah, sewage. Yeah, so there's no sewage in the water, and we keep Duxbury clean. So that is our matching requirement. It might have been more going forward, but I was able to get the program to give us additional funds next year, and that will continue thereon. So we're very fortunate to be able to augment that additional cost of the town through the federal and state government. And then our overtime budget doesn't change. Next slide. And what I did is I tried to just highlight. I'm not going to go through everyone. What I'm going to do is basically say every single department that you'll see and have heard or will hear is that we are very financially responsible. And a $1,000 line item going up $100 may not seem like much, but that's a 10% increase in a single line item. And for instance, equipment maintenance supplies, these are things that we purchase so we as the department can fix the items. So we do a lot of the maintenance on the town pier and the floats and stuff like that. Everybody knows the cost of everything is going up, and that's in order to keep us to be able to maintain the things that we have. Membership and dues, that might be one that some people may have a question on for $100, but that membership and dues provides us the opportunity to get free training with other membership communities. So we pay dues and we get free training. So that's why we're able to keep our training line item down. So, well, sorry, I feel like I just ran through that, and I'm willing to answer any specific questions.
Jake, in your presentation to, finance committee, you had, discussed an increase in your hourly wage for your intermittent and seasonal. What's
Yeah.
the big driver in a request?
So what the biggest thing that we've done is, we obviously, every single one of the department heads will be able to tell you, we're very close with our other communities. And I found that we are losing a substantial amount of potential employees, part-time seasonal employees, because we don't offer as a competitive wage as others. I was able to establish a co-op with Massachusetts Maritime Academy, so we were able to get some students there. But unfortunately, what was happening is other departments started figuring out and started taking those opportunities away because they could afford, they could pay more money. I'm just trying to get to be able to not only get new people, but hold on to the people, because I have a very limited window to train part-time staff. And if I'm training part-time staff every single year, and I'm losing potentially better qualified staff to other departments, I'm gonna spend a lot more time training and less time doing what needs to be done. So I hope that answers your questions.
I think you had given us just an example of hourly wages in competitive towns versus.
Yeah, so, right, so we are underfunded so for instance, let's say, I think the town of Situate is $20 an hour. And that's what we're looking to get. Situate, Marshfield, Plymouth, that's what we're trying to compete with. And we want to be able to, we're not looking to start making a new pay raise or a pay increase for people, but this is just to be able to keep people and attract staff, quality staff.
Select board?
Questions?
What's that?
Well, very clear. Thank you, Jake.
Okay.
Thank you.
Audience?
Can I ask a question?
Yes.
Yeah, please, yeah.
We thought you'd only had answers.
Oh, you'd be so wrong about that, friend. So first off, I want to thank our public safety staff for coming in tonight. You guys did a great job, and this has been a very difficult process for the entire community. And we thank you for being here and sharing critical information with us tonight. So I guess we've now conducted 2 joint meetings of the Finance Committee and the Select Board. We're grateful for the public participation, and just so that everybody knows, we also have about 30 to 31 some odd folks who are joining us remotely. And so it's great to be able to reach the community. I guess my question is for the Select Board, because I know that the Finance Committee has been eager to start to vote on some of these recommendations. And I just want to be sure that the Select Board, when we complete these meetings, that you feel as though you have gotten the information from the departments that we're bringing here in front of you, so that you are able to make a recommendation on their particular budgets. I see some head shaking, that's correct.
Question maybe.
So I guess my
The question is there an expectation that we vote at the end of tonight, or a recommendation, or we vote at the end of the complete review?
So I think the consensus was that we were going to try to vote the contingency budget, make the recommendations at the end of the process. But what I want to do is make sure, the reason that we're bringing these departments in is to provide enough information for you to have a recommendation, so that when we get to that point and we say, what is the recommendation of the Select Board, what is the recommendation of the Finance Committee, that we're not having to answer additional questions, that we are prepared to make that recommendation known to the community. So when we leave here tonight, I just want to make sure that you guys are all set with these departments. I see some head shaking.
Can I just add to that? In a perfect world, what we know is what we know right now, and we could say, yeah, I heard, I don't have any additional questions right now. But as we all know, what happens is after discussion, you get public contact us, we
have further discussion, we hear other things, we may have to come up with some questions after we get home and kind of digest all this information. We very well may have some additional questions, so I don't think that for me, that's not an answer that is easy to answer.
Okay, so
So then to envision this process and set expectations for the community and for us, we are scheduled for 2 more meetings. So we have DPW, all of the DPW departments scheduled for next Thursday. And then we have all of the other remaining departments scheduled for the following week. And would it be safe to say that for that second meeting, where we're hoping to have a recommendation of these bodies, that we need to have all of our department heads back? So you'll be able to answer your questions without the department heads present.
Just speaking for myself, I think that even if a member of the public came up and asked me a question and I needed the answer to it, I could try to find that out. There's no question that anybody's gonna ask me that's gonna change my opinion on whether or not the folks in their departments, need these budget requests.
Okay.
That's,
Thank you. Okay, I'm just trying to logistically, trying to understand our process so that we're all on the same page, have the same expectations, and know that we have the right people in the room for you in order to be able to come to that recommendation. Thank you.
there's one more question from,
Tag Carpenter is online with a hand raised. Give us a second to.
Okay, Tad, you should be.
Yes, thank you. I appreciate that. I don't have a specific question, but a question was raised earlier that I'd like to provide some insight to and perhaps an answer for the residents regarding the increase in public safety calls. What's driving the demand? And I'm going to step away from the budget that's facing us, that we're really confronting, and just provide this background very briefly, as I know it's late. And this has to do with our environment. Can you hear me?
Yep.
Okay. Just very briefly, everyone is aware that atmospheric carbon dioxide is increasing. When I was born, it was about 320 parts per million, and it is now about 420 parts per million. And there have been scientific studies of office meetings where they measured the carbon dioxide in a room, closed room, and it went from atmospheric level of 400, and by the end of the meeting, it got to 1,000. And by the end of the meeting, there was evidence collected that indicated that people's actual ability to think and reason was decreased by 5 to 10%. So this is a background force, a forcing function, and it is a very subtle source of stress. People are experiencing increasing stress. It makes people irritable. It makes people reactive. And as long as we understand this, we can deal with it. And the other thing I want to point out, this is a separate subject, is that we are service oriented. We face the public and we serve the public extremely well. And just like Katie was saying, the equipment is in the background. The equipment hums away, and when we practice benign neglect, we assume it's okay, and nobody checks it until it breaks. And that worked great for a long time, but we're in such a technically intensive age that strategy can no longer work. So these are fundamental shifts that are driving our budgets up, and there isn't any cost cutting that can solve these problems. It's an increase in expense, and it's just got to be dealt with. That's all I'd like to say. Thank you.
thanks, Tag.
Thanks, Tag.
Okay. All set? Motion to adjourn.
Second.
All those in favor?
Aye.
Second.
So moved.